Hi everyone, my name is Alex Kartasopoulos. I'm doing my presentation today in the field of neurology, and I'm talking specifically about deep brain stimulation and what it is. Deep brain stimulation is a surgical procedure using implanted electrodes to deliver electrical impulses to specific areas of the brain. The purpose of it is to regulate abnormal nerve signals, paresthesia, in movement disorders, either hypokinetic, which means less movement, or hyperkinetic, which means too much movement. The key components of the DBS system are electrodes implanted in the brain, an extension wire under the skin, and an implantable pulse generator battery in the chest, just like one that one would have for a pacemaker. Conditions treated by the DBS system. That would be movement disorders like Parkinson's disease and dystonia. Other applications include epilepsy, obsessive compulsive disorder, Tourette's syndrome, cerebral palsy, and even stroke victims. So how does the DBS work? Electrical stimulation alters abnormal brain signals, targets brain regions like the thalamus, the hippocampus, the globus pellicus internus, and the subthalamic nuclei. What this does is improves motor symptoms by modulating brain activity. So the DBS surgery and procedure. It starts by implanting electrodes through a small opening drilled into the skull, connecting those electrodes to the pulse generator in the chest. Then, after about a month or so, the programming and tuning of the signals is done post-surgery. It's typically performed on patients who are unresponsive or intolerant to the medications they need to take for the different diseases and symptoms that they have. Advantages of the DBS system. It's adjustable and reversible treatment. The battery and stimulation can be changed without further treatment. It's continuous symptom control. Can reduce medication dosage and related side effects from medication. Adaptive DBS advances monitor brain signals to improve targeting and reduce side effects. That's mostly done through AI systems. Adaptive DBS is really on the forefront. It's not really the DBS that everyone gets when they go in to get it. Some risks and considerations to think about before you get DBS. The surgery risks, which are always present, is infection. They're going to be cutting open right around your brain, so brain infection is highly, highly risky. Bleeding into your brain, which you wouldn't even know about, is also risky, or device complications. The device can go out of order. It can, if you charge while it's wet, it could send a shock to your system and could have a negative side effect. It's not suitable for patients with dementia. Essentially, you have to charge your system every once in a while, at least once a week. So patients with dementia, they would get the system and then forget that they had the system. They potentially could forget what to do the best way with the system. Some side effects may include speech difficulties or balance problems. This could be simply from if you have electrodes on both sides of your brain, you can experience the balance problems from one side to the other, just because the left side of your brain targets the right side of your body, the right side of your brain targets the left side of your body. There's nothing that really targets your whole body, essentially. And it requires ongoing medical follow-up and programming. You're going to have the battery replaced depending on the company, every 1 to 3 years. And as far as the programming, that happens based on the patient's ease of getting into it. So it can happen every 1 month you can be programmed, or every 3 months, every 6 months at the most, I would say, if you're really susceptible to the shocks that the DBS system sends to your brain. So patient selection and preparation. This is done through multiple MRI and CT scans, as well as blood tests. This is just to ensure that you're falling in the right categories for everything, and that there's not something that they could remove surgically or potentially help you with in another way through medication to ease the side effects better of your disease, rather than implanting the DBS system into you or something similar. Candidates typically have symptoms significantly affecting the quality of life. That's because these neurological and psychological disorders are extremely violent to a lot of people. People lose their abilities to do anything without someone there to help them. They must show some benefit from medications before they go on the DBS system. That's simply because they want to get you on the medications, have the benefit shown, and then put in the DBS system. Once the DBS system is in, they're going to do the programming, make sure they get it right. And once they get the right programming done, they're going to start fine-tuning down your medication to see if your symptoms start improving or get worse, and that would tell them that the DBS is working or it's not. So where is the future of DBS going? So it's expanding indications and refining targets in the brain. That basically means setting up more electrodes in the brain to create a more personalized DBS system for you. And that also goes hand in hand with the adaptive DBS systems, which use AI for personalized therapy and will continue to change where they send the shocks to and send your brain into the new stasis. Research on treating non-motor and cognitive effects such as depression or aggression. Basically, where DBS is right now, it's all in motor symptoms. It's all in motor treatments. That's for stuff like Parkinson's and stuff like epilepsy and whatnot. But it'll start to go a little more psychological, hopefully. And the clinical trials are ongoing and various neurological and psychological connections. That basically just means what I just said. It's all moving towards creating a more expansive treatment for the whole entire neurological system. So Why am I telling you all of this? I could have talked about anything in the neurological system. I could have talked about any neurological disorders or symptoms even, but I'm telling you all of this because I'm currently a patient undergoing the DBS trials. In 2018, I had my first seizure and diagnosed with multifocal epilepsy disorder, which means basically I have epilepsy and it comes from 2 points in my brain. It comes from my left frontal lobe and my right hippocampus. About a month ago, on October 3rd, I underwent the treatment for DBS and had my skull opened with 4 electrodes placed on my brain. One was on my right frontal lobe, one was on my right hippocampus, one was on my left frontal lobe, and one was on my thalamus gland in the back. You can still see the scars going each way. And then there's also a scar back here where the probes lead down and into my chest where the battery is. Yesterday, November 6th, I underwent programming. It was quite an odd experience, honestly. Feeling things like hemiparesis. Basically, they would turn up my left frontal lobe, and at one point my right finger felt numb, and I told them about that, and they said that's normal, we'll keep going. And then they turned it up one more, and my nose to my right eye felt numb right in here. Told them about that, kept going. And then on the next one, my whole entire right side of my body got numb and I couldn't feel anything. They said that's basically my tipping point. They scaled it back down, and essentially through the programming, it'll continue to get better. I'll get more used to the shocks in my brain, and the stasis will stay the same, or not stay, it will change over time. And basically it also included a bit of slurring of my words, inability to focus on an object. I was looking from person to person, to my mom. My left eye slipped down a little bit, all kinds of different things. And once we finished up, I felt like a normal person. It's just now I have shocks going to different parts of my brain, keeping it in a new place, essentially. I'm still very confident in the procedure and the effects it will have on my epilepsy disorder. I'm grateful, you know. It's a very cool treatment, and I'm cool to be at the forefront of it. So, in summary, DBS is a transformative therapy that has worked extremely well for many people before me and will continue for many people after me. It involves neurosurgical implantation with ongoing management and programming. It also offers reversible adjustable symptom control, improving a patient's quality of life. I feel very blessed and grateful to be at the beginning of this amazing leap in surgical procedure of neurological and psychological disorders. Thank you all for listening to my presentation and listening to me drone on. I know I have a bit of a, how should I say this, a single tone to my voice, but it's what I get with who I am. So again, thank you very much, and I hope to meet some of you in our future studies. Have a good day.